Hi, my name's Karen. I was assigned to follow you around today. Do you mind giving me a report?
No, not at all. Hi, Karen. My name is Jessica Kwolek. I'm going to be the nurse of Ryder Kine today, and he is in room 620, and he's 67 years old. He is a stage 2 diabetic. He's had that for 20 years. For the past 3 weeks, he's had a non-healing wound on his right heel. So he's also in here for that, and hyperglycemia. He has no known allergies. He's a fall risk. He's non-telly. He has peripheral right forearm IV site. He is room air. He's alert and oriented ×4. He's quite active. Like once a week, he goes bowling and has 1 beer or so. He's up ad lib, and he Q8 vitals, and he's while in the hospital, he's on a 1800 diabetic 2-gram sodium diet, and everything seemed to be good when I went to assess him this morning. Normal bowel sounds in all 4 quadrants. The lung sounds and heart sounds were good. So pretty much he's just in here for his hyperglycemia and the ulcer on his heel. And then I think, is there any other questions?
Why specifically is he receiving this medication?
He's receiving, it's the regular insulin. The last time we checked his, just a few hours, or just like an hour ago or so, his blood glucose level was 290. So it's a little high, so we're just going to give him the regular insulin.
What action does the medication have on his body?
Well, the insulin, it promotes the storage and inhibits the breakdown of glucose, fat, and amino acids. So with that, it's going to lower his blood glucose.
And when should you question administering this medication?
Probably if his glucose was a little lower, like in between 80 to 120, we probably would not give it to him.
And does the medication have a therapeutic serum level?
Yeah, so 80 to 120 is the normal range.
Are there any other vital signs that we'd have to monitor besides his blood glucose?
It's always good to just take a full, like blood pressure, respiration, oxygen, just to make sure everything is good.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
Okay, a good question. First thing, just for him to recognize the signs of hyper and hypoglycemia. Like for hypoglycemia, just like sweating, lethargic, confusion, and that kind of stuff. And then also, I think he mentioned before that he gives it into his abdomen, but just let him be aware to change sites every now and then.
Is there any different interventions that he should make sure he's taking care of when he's at home safely?
Just, I guess just checking the glucose level on a daily level and then changing the sites, like I said.
Okay. Are there any potential side effects or adverse reactions?
Yeah, he can become hypoglycemia by giving either too much insulin or give it when it's not needed.
And how will you know the medication is effective?
By checking the glucose level and making sure that's in the therapeutic serum range.
Okay, thank you for answering my questions.
You're welcome. So if you want to come over here, I'm going to draw up the medication. Okay, so today, since I checked the orders, and he's on a sliding scale, so his glucose was 290. So with the 290 glucose, we're going to give 16 units, and then so we'll do that now. Everything's clean. And I like to just, so you want to check the expiration date, and then check to make sure with the orders that we're given the right medication and the correct units, and then make sure that's all the patient's name and stuff, and make sure that the name is, the dosage is correct, and the route. Okay, so then first we'll just, we'll draw back 16 units of air. There, I just retracted that needle. Okay. Okay, so 16 units. Okay, and then I had already alcohol swabbed that, so we're just going to put the air in there. And then draw back 16 units. Make sure that all the air bubbles are out. Okay. Okay. We got 16. And then we'll just recount like that. And then we'll put the. Okay, so clean up. I guess we're ready to go see the patient. Are you ready?
Yep.
Okay. Knock. Hey there. My name is Jessica. I'm going to be your nurse for today. I have a student, Karen, with me today. Okay. And then, so it's okay that she's in here? Yeah. Okay. So I just have regular insulin to give you today. I'm just going to check your name bank. Can you read your name and date of birth?
Ryder Kind, 67.
Okay. Do you have any allergies?
Nope.
Okay. Okay. I'm going to wash my hands. Okay, and so I have regular insulin to give you today.
Okay.
Have you, where would you like me to give it to you?
No, my stomach's fine.
Okay. And then so you know like how long to rotate the injection sites just to, okay. And so, and then what I like to do here, so we're going to go to, so we verified with the orders to make sure that that we're giving, that matches up with the doctor's order. So we'll go over here to the MAR, and it shows that a regular insulin is now due. Okay, so then we verify the patient's name and date of birth and make sure with the allergies and stuff. So we'll click on that. Okay, so I guess we'll go ahead and give it a scan. Okay, that's good. And then we'll give the medication to scan. And then I also heard that you, the doctor had said that you had wanted some information on diabetes and like nutrition and exercise.
Yeah, I haven't
Okay.
been doing so hot on my nutrition.
That's how it normally goes. But I did print off some information that I can give to you,
Okay,
and we'll make sure that you are aware of like just anything with your insulin. Make sure that you're aware of like signs and symptoms of hypoglycemia and hyperglycemia. Okay, so I'll go ahead and alcohol swab the space first. Okay. There you go. Okay. And then take these off. Okay. And so do you know some of the signs and symptoms of hypoglycemia?
Confusion, sweating,
Okay,
pale
good.
skin.
Okay, good. And then if it gets either too low or too high and you can't control it, definitely call your doctor and call 911 for help as well. But here's a nice little pamphlet of diet and exercise, and then your breakfast, your dinner tray is here. So go ahead and make sure you eat to keep everything going.
Okay.
And then, do you have any other questions?
Nope.
Okay.
Good,
So
thank
we'll
you.
go ahead and we'll be back to check on you. Okie dokie.
All right, thank you.
All right, thank you. Okay, and so I'm just going to document where I gave it and when and how and then what the glucose level was that that way it shows why I gave it. Do you have any other questions?
Yeah, were there any pertinent pieces of information that you needed to review before administering the client the medication?
Yeah, you definitely want to make sure you check the doctor's orders, and then make sure you check the glucose level, because obviously if the glucose level was lower, you wouldn't have given it. But even if like the doctor says to, but you know, you just always want to make sure you check the labs first. But yeah, so just the doctor's orders and the level.
Did the information affect how you administered the medication?
No, because like we just asked him where his preferred method was.
Okay, I think you've answered all my questions.
Okay, cool. You want to come watch me try?
Okay.
Okay. Sounds good.
The end.